Hello, this is Dr. Charlie Schwengel at Medicine of Hope, and this video is to demonstrate and review the instructions for our Hope for Cancer Consultation test kit. When you order the test kit, you will receive in the mail in about 2 days a prior to mail envelope like this. The envelope will have all the paperwork in it, and of course, no job is complete till the paperwork is finished. So you open the envelope, and inside you will find a collection kit, which is a little plastic sleeve with some cotton Q-tips in it, and the label. So the first thing you do is put your name on it, of course, and put the date of the collection. And set this aside. Now you should look at the collection instructions for the cheek swabs. This is a small brochure, and there are 4 pages to it. And I certainly think that it would be smart to look over all the instructions before you begin to be sure that you understand what it says and how to do it. The next thing is a little brochure about the Hope for Cancer Consultation. This is information that describes why this is useful, and perhaps if you have somebody you know you'd like to refer to, you can use this brochure to give to that other person. There will be a white envelope that's already addressed and will already have stamps on it to come back to us, so this is postage paid. And on the back side of the envelope is going to be a reminder list of what belongs in here before you seal the envelope. So we'll set this aside for the moment. Then there are some pages to look at. One is the informed consent, which means that we'd like to have you review this thing and sign, which actually gives us permission to do this kind of a test for you on samples that have come from you to come back to us. So you'll review this, sign, and date it, and it will go into that white envelope. There is a history and questionnaire. This is a 2-page form. We'd like you to fill this out, which is just a brief information about yourself and about the nature of the diagnosis, how that happened, and there's a space to put in information or maybe ask a question about what else you'd like to tell us about. So you'll fill that out, 2 pages, and that comes back to us. The last paper is a payment selection sheet where you can select to pay either with a check or by credit card, and if you choose to use credit card, be sure and fill out this bottom part. And it's important to remember that 100% of this fee will apply toward the first visit when you come here to be a patient. So all of these things you will fill out. You can put them together and fold them in half, and they will go right into the white envelope that's going to come back to us. Now you're ready to do the collection. Part of the instructions say to be sure to rinse your mouth before you start and allow about 15 minutes before drinking or eating anything. In this envelope there are 4 little cotton-tipped applicators. You take 2 of these and use on one side and 2 for the other side. So we'll set 2 of them down and hold just 2 right now, and we'll begin on the left. So you'll want to place these between your cheek and the inside of the teeth so that you use pressure about like you would by brushing your teeth, not a lot. So starting on the outside lining of the teeth and inside the cheek toward the back, just like this. And you'll rub this well for just a few strokes is all it takes. And then very carefully, and without touching the ends of these things, open that little plastic bag and put them in there. And we'll do the same thing with the other 2 swabs on the other side. 4 or 5 strokes with a little gentle pressure is all it needs. Now you'll notice at this point that the sticks are longer than the bag is tall. So what you'll do is hold the sticks on the middle about where the bag is with one hand with a little firm pressure, and with the other hand just break it like so, and you discard the extra pieces and then seal the bag tightly. So now you have a collection bag with your name and date on it and the samples that are inside of it that's tightly sealed, and this goes into the envelope. Now you're ready to seal the envelope, and look on the back again to be sure that we've got all the steps and everything is complete and finished, and then it's ready to go back into the mail, and it will be postage prepaid. Just like that.